Welcome to Hamlin Dental Group. Our office offers an array of services, including cosmetic dentistry, fixed and removable prosthodontics, specialties such as oral surgery, periodontists, and orthodontists. Let's focus our attention on a crown. The most common factors a person needs a crown is after a root canal. We want to give that tooth strength to ensure long-term success of that root canal, to be able to chew and smile. Crowns are needed for several reasons, such as decay, trauma, or wearing down of a tooth. A crown is placed to give the tooth strength, or misshaped teeth, discoloration for aesthetic purposes to improve your smile, or after a root canal. Since the tooth is broken down, we want to give it long-term success and enclose the tooth for proper chewing. Crowns may not last forever. Its lifespan varies from 5 to 10 years depending on good oral hygiene. It is important that you take care of your crown just as you would your natural teeth, with flossing, brushing, and visiting your dentists. If you are in need of a crown, allow your dentist 2 visits to complete the procedure. Getting started on your crown, your dentist will give you local anesthesia to create comfort during the procedure. The tooth will be reduced in size to accommodate the crown once it's returned from the laboratory. Depending on how much tooth structure is missing, an additional procedure such as build-up will be needed to ensure good fitting of your crown. Impressions of your tooth will be taken. This mold will get submitted to the laboratory where your final restoration will be manufactured. A second appointment would be given. At this point in time, your final crown would be cemented if color and fit is adequate. During this time, a temporary crown is placed on your tooth to protect it and minimize discomfort from sensitivity. Some adjustments might be needed once your crown comes back. Allow some time to heal for your bites and your gums to minimize sensitivity. Some prescription might be given for your doctor to minimize discomfort. Now, why a crown? You would think that a filling can solve the problem. However, this is not always the case. If the decay has been extensive and has involved too many of the cuts, the tooth structure is compromised. And by placing a filling, in the long term, it would only cause harm. The tooth can break and you might end up losing your tooth. The crown will ensure a good structure and to be able to use your tooth as it was intended. It was so good to have you in the office today. We hope your experience was pleasant. Much improved on your oral hygiene. Continue to develop good habits as far as brushing after every meal. You can't do without the flossing and rinsing. Don't forget to make your appointment on your way out. We'll see you in 6 months.